This pad thai is $8.95.
Here in the Northern Territory's biggest remote community, Maningrida, Matthew Made and Anita Jalom are picking their groceries.
$32 for one piece of chicken.
But it's a struggle to afford everything they need. They're both currently on job seeker welfare payments.
Yeah, I don't know which one cheaper, whole chicken or maybe I'll get this one.
Grocery prices in remote communities are typically double those in the city, according to consumer group Choice.
Sometimes we don't come shopping, we got no money. Yeah, we're staying at home.
They also can't afford electricity to keep the fridge on.
Sometimes we spend in the power, sometimes we spend food. Maybe food we get maybe less, little food.
Worry about food, they might get sick.
Because we got not enough
food
money
and not enough pay.
They want the federal government to help lower remote food prices and increase welfare payments so they can afford to buy more. The local not-for-profit Indigenous Association, which owns the general store, subsidises healthy food prices with its profits from non-essentials. But freight costs to the community, which is more than 500 kilometres from Darwin on dirt roads and a few days away by sea in the wet season, are high.
We continually monitor our pricing. Because we're not government funded, we don't have any source of revenue other than what we make as a business.
The association had to hike up its prices last year after the barge service supplying food stopped running when its vessel was damaged. It says the remaining barge service, Sea Swift, was more expensive and it had to pass on those higher freight costs to customers.
The freight cost that we incurred was 2.5 times what we were being charged before.
Sea Swift told 730, prices of our services are in accordance with operating costs. We try to remain as reasonable as possible and have the community front of mind. The association says it has now found a solution. It ended its contract with Sea Swift last month and has since contracted a cheaper competitor for a 12-month trial.
I think the forces of competition will ensure that our freight rates are at a reasonable rate again.
But the new barge service is just helping prevent food prices from rising further, not reducing them. Local organisations here in Maningrida are doing what they can to tackle the impacts of high food prices, but they say it's not enough. The federal government has been promising since May last year to help remote residents with food costs. Yesterday, as part of its Closing the Gap commitments, it announced it will set price caps on 30 key items, subsidising things like milk, bread, eggs and toilet paper at 76 of the more than 200 remote stores across the country. It's yet to be decided exactly which communities will benefit. The locations will be selected by a government and industry advisory group based on where the greatest need is.
We will work in collaboration with that food security working group as well as others to identify closely those communities that are at risk in terms of the access for the food supply.
Some Indigenous policy researchers believe price caps could work to a degree.
It's going to be helpful, but it's only going to help a minority of people in a minority of places purchasing some of their items. So while it's a good start, it's probably not enough to really make a huge difference to people's lives.
Francis Markham thinks raising welfare payments for all remote residents would be a better solution, although he concedes that would be much more expensive. It's not something the federal government is offering now.
What I'm suggesting is that social security payments going to people living in these places where the cost of living is so high should be increased by around 39%.
If the coalition wins the next election, it will review Labor's policy, telling 730 that it wants to ensure money is spent where it will produce outcomes. It is also committed to reinstating the cashless debit card, saying when it was in place, people were more likely to spend income on things like food as opposed to alcohol or other substances.
We have very high rates of diabetes, ischemic heart disease, young people in their 30s and 40s having heart attacks.
On the ground, Aboriginal controlled health services are educating people about healthy food.
I guess the thing is that we can have all the programs in the world and we can tell people what they need to be eating, but if they don't have access to that food, if it is too expensive, then nothing is going to change.
Valda Bok-Makaray and her friends have driven out of town and are gathering seafood to supplement their diet. Not everyone can do this.
We have to make the prices low at the community, at remote communities, and make it balance it, you know. But at least that we're lucky here because we go and get bush tuckers as well, you know, and bring it back and take it home and share it with our family.